Good day, everyone. I welcome you to this professional training course program titled First Aid and CPU. My name is Azuka Innocent Chibueze. The course before us, as we said, is First Aid and CPU. First of all, you ask yourself, what is first aid? Who is a first aider? And what do we mean by CPU? Now, to know the overall course, we have to know that CPU and first aid is a practical and competency-based course that prepared learner to recognize medical emergencies. One, two, to provide immediate care and to perform life-saving intervention until professional medical services arrived. So if these professional medical services have not arrived, your primary duty is to ensure that the victim life is saved and immediate care is given. So this course is combined of both theoretical knowledge with practical skill to enable you as a participant to respond confidently and effectively during emergency. Now you go back to the slide and ask yourself, what is first aid? So from what you have seen and on the screen, it is the initial treatment given to a victim before taking him or her to the hospital or the arrival of a doctor. The arrival of the doctor, if the doctor have not arrived, so your primary duty is to be with the victim at the scene to ensure life is restored. So if life is not restored and nothing has been done, you carry her or him to the hospital. So quickly, we now look at what is first aid. We have looked at the first one. Now, secondly, you understand that first aid is also the immediate assistance given to a patient who has injured or suddenly becomes ill before professional medical arrived. So if this medical treatment is not available or they are not around, your primary duty is to administer immediate assistance to the victim to ensure life is restored, even though it's a very serious injury. You have to give him hope and give him assurance of second chance. Purpose of this first aid: one is to preserve life. One is to preserve life, as I've said. Number two is to prevent the condition from worsening. So when you make the condition, she shouldn't get worse even at your arrival. So you should ensure you prevent the condition from worsening. Number three is to promote recovery. Number four is to provide comfort and reassurance. Next is to reduce the risk of permanent disability. So the risk of permanent disability should be reduced. Now, as a first aid, as a first aider, you need to be skillful, and that skill you have acquired enables you to apply the principles of treatment on the occurrence of any injury of sudden illness using facilities or material available to you at any time. So the material available to you at any time should be made use of before the arrival of the doctor. So this method is approved of treating a casualty until place if necessary in the care of the hospital or removed to the hospital. So now the scope of this first aid, there are scopes that surround it. Number one is diagnosis. Number one is diagnosis. What are you diagnosing? So as a first aider, you should be able to identify and say in a simple terms what the problem of the victim is. Example is breathing, broken, unconsciousness. So you should be able to define it. You should be able to identify it once you get to the scene. Number two is treatment. Once you have identified it, The next thing is to treat, but this treatment here implies all measures taken to preserve the life of the victim. This is not the use of drugs. So the condition from getting worse, you have to prevent it and relieve of pain from that victim. That is what it is. It is not. It doesn't involve the use of drugs. Number three, because you're not a doctor, you're not a nurse, so it doesn't approve that. Number four, three is evacuation. As a first aider should institute evacuation due procedure as laid down by the organization, and if communication contact is impossible, make arrangements to transport the victim to nearest hospital clinic as quickly as possible. You have contacted the relations, the family, and it's not possible. So make use of the transport and move the victim to the nearest hospital. What are the qualities of a first aid? And number one is observance. You have to observe the environment, observe yourself, observe the victims. Number two is carefulness. You have to be careful the kind of things you do with the victim. Confidence, you have to be sure of yourself that you know what you are doing. Perseverance, you have to be patient with the patient. You have to be patient with the patient, ensuring that life is being restored, hope is being given to the person. Number two is tactfulness. You have to apply skill in what you are doing. Sympathetic. You have to apply sympathetic. You have to be sympathy on the patient. Resourceful. Any material available is what you are expected to use. Explicit and exercise good judgment. So there are general rules guiding you as a first aider. One is reassure the victim at all time, giving him hope, giving him reason that he will not die, he will live. Do not move the victim unless absolutely necessary. Do not allow people to crowd around you. It's very, very necessary. People don't need to crowd you, or else there will be a problem. Do not leave the victim unattended until the doctor take charge. Okay, you have to lose all the tight thing around the waist to ensure the flow of breathing and flow of circulation of blood. You can see from the material you are seeing on the screen how it is being carried out. Because of time, look at the general rule guiding this particular scenario. Now look at this scenario. This man is lifeless and he needs your help to ensure that this bleeding stop. This is bleeding. What do you do at this point in time? Number one is to stay calm, do not panic, and take charge of the situation. You have to be in charge by giving the man hope, or the woman hope that don't worry, before the doctor comes, you'll be fine. If the situation is getting worse, you move him straight to the hospital before they arrive. Or if you have called doctor, then doctor could, but stay calm, do not panic. Number two, use your common sense at all time. Rules may be broken. Use your common sense. Your common sense should tell you this is what should be done, this is what should be applied. And number three, do not attempt to do too much. If you're unsure of what to do, if you're not sure of what you are doing, do not attempt to do too much. I think you have understood what I have stated since for the past 5 minutes. Then you should be able to understand what we are talking. Now, at this point in time, we call it a day. We'll see in our next slide. Thank you very much for your time, and take a view on this picture, and we'll come back next time to explain more in details. Thank you very much. See you in our next slide. Bye.